Hey guys, welcome to your lesson on eczema. So this is a pretty common diagnosis for our pediatric patients. And what we're going to do today is just talk about how we're going to identify it and the things we need to be looking for in our assessment. And then just also talking about how we provide nursing care for a child with eczema. And one thing I want you to keep in mind as we go through this lesson is just that kids who have eczema, severe eczema especially, can be really miserable. It's very itchy, and it can just really make it difficult for them to be doing the things that kids need to be doing, like playing and going to school. So one of our major goals with this is just to try and give them the best quality of life that they can as they're dealing with something that can be pretty annoying. So let's just keep that in mind as we go through these next couple slides. Eczema is the same thing as dermatitis, and dermatitis just means inflammation and irritation of the skin. And there are 4 different types of eczema that you need to be familiar with. And the first one here is atopic eczema. And atopic eczema or atopic dermatitis is what we're going to spend the majority of this lesson talking about. But first things first, atopic or atopy literally just means that we're talking about allergies that are associated with a genetic element. So all this means is that if you see a child who has atopic eczema, you're probably going to find out when you're chatting to the family that someone else in the family has it also. And there are a couple of other diagnoses that are really common in pediatrics just to be aware of that are also atopic. And those things are seasonal allergies, asthma, and then the topic that we're talking about now, which is eczema. So these 3 diagnoses all have an atopic element to them. And so a lot of times they come together. So if you have a patient who has asthma, they probably have eczema and seasonal allergies as well. So just during your clinicals, be on the lookout for this pattern as you're talking to families and sort of getting different medical histories. So contact eczema or contact dermatitis, this just basically happens when the skin comes into contact with something that's irritating. For some people, this might be something like a strawberry or just an allergen that they have a reaction to. But a really common thing that people have a contact dermatitis reaction to are just different types of plants that can be really irritating to the skin. The third type of eczema we're looking at here is the xerotic eczema. And xerotic eczema happens when you have really dry skin plus a lot of rubbing or friction. And the perfect example of this is just babies who are crawling. So they're crawling around a lot on carpet and on hard surfaces, and so they can get patches of this xerotic eczema on their knees from the constant friction that their knees are getting from the crawling. And the last one is the seborrheic eczema, and seborrheic dermatitis is typically only seen on the head and face. And another word for it is cradle cap, and you've probably seen or heard that phrase quite a bit when you're talking about newborn babies. And basically it's just dry skin that's peeling off, and it doesn't have the same characteristics of some of the other ones where the skin's also really red and irritated. And like I said, for this one, we're focusing on atopic eczema. So as we move forward, when I say eczema, that's the one I'm talking about. So for your nursing assessment, you need to know that eczema is red, inflamed, and super itchy. Sometimes the rash can also have vesicles and pustules, and those can become kind of crusty lesions. But primarily it's that red and itchy, very irritated skin that we're looking for. So we're going to take a look at these photos just to talk through and guide us through some other things that we need to be on the lookout for as well. So the first photo that you see here is an example of infantile atopic dermatitis. And basically infantile dermatitis is more widespread than childhood dermatitis, which is sort of what we're focusing on in this lesson. And by more widespread, I just mean that it can be on the face, on the trunk, on the extremities, more all over the body. And this is different than childhood dermatitis. Childhood dermatitis is usually seen on the flexural areas. And flexural just means places on the body that we bend and move a lot, like elbows and ankles and feet. And hands and wrists. And you can see in the second photo what eczema will look like on that flexural surface. The third photo that you see here is a really good example of something called lichenification. Lichenification is just basically thickened and hardened skin in those areas that are constantly being irritated and scratched. And this last photo here is a really important example of a secondary infection. So with a patient who has eczema, All of our management is focused on preventing that secondary infection. So from an assessment point of view, we really have to be on the lookout for that. This particular photo is eczema herpeticum. And so basically that's eczema that has been infected by the herpes virus. And sometimes you'll see patients with this. They often have to actually be admitted to hospital because it's very, very painful, and they usually need IV meds to treat it. Another infection that you might see with eczema is impetigo, and with it you'll notice a unique honey-colored crust on the rash. And we have a whole lesson on impetigo, so go check that out for more information on how we treat it. And the last thing I want to say here when we're talking about assessment, and it goes back to what I mentioned earlier, is you really want to be assessing for impact. So we want to know how well this child is coping. Are they sleeping? Are they playing? Are they going to school? Are they being bullied? All those different things are really important. And if those things aren't going well for the child, then it's not being managed well enough, and we need to figure out why. So let's quickly recap. What we're looking for is a red, inflamed, very itchy rash. And we're making sure that we're assessing for signs of infection and also paying attention to impact. Okay, so our first priority with eczema is to relieve pruritus. And pruritus is just a fancy word for itching. And itching is really just kind of the root of all of our problems with eczema. So you've got a child who has skin that really itches, and so they're going to scratch it, and the scratching causes the skin to become more dry and more irritated and more red, which then causes it to itch even more. So the kid scratches it even more, and eventually our skin becomes broken and the area can become infected. So if we can stop or minimize that itching, we're really going to be able to minimize discomfort and then also really reduce that risk for infection. So a couple things we need to do to relieve that pruritus or the itching. The first thing is to identify the irritants, and this is going to be different for every child. But a really common one is cow's milk, and so that child may need to eliminate cow's milk from their diet. The second thing we're going to do is really focus on keeping that skin really hydrated so that it's not dry and itchy. And I love this phrase, I saw this in an article, is calling it soak and seal. So we're going to just get that skin really wet and moist, and the way that we encourage families to do this is to take lukewarm baths. These baths should not last for any longer than 5 minutes, or it can have the reverse effect and dry their skin out. And they can do this up to 3 times a day. And as soon as they get out of the bath, they need to apply an emollient. And emollients are just non-cosmetic ointments and lotions. They don't have any of the ingredients that can irritate or dry out the skin. And they need to apply those emollients very liberally. So they get in the tub, they get nice and wet, and then they soak, and then they're going to seal all of that moisture in. And those are really going to help relieve that itching. The next thing we're going to be focusing on is promoting skin integrity. And again, I said the first step in that is relieving the itching. The second things that we're going to be doing for that are we may be using bandages if the skin's broken and needs to be protected. And we're also going to keep the child's nails very short. Okay, and this is going to prevent the skin from breaking down if they are itching and need to scratch. The next thing we're going to be doing is providing medications that, again, promote skin integrity and relieve pruritus. And the common medications that you'll see are antihistamines, steroids, and immunomodulators. And antihistamines are very important because they can just basically give the child some relief. So it helps with the itching, and then it also helps them get some rest that they might be really missing out on. Steroids are important because they reduce inflammation, and they also help decrease the itching. A lot of steroids, like cortisone, can be purchased over the counter. Really important thing to teach families is that steroids should always be applied very thinly. And this is the opposite of what we said about emollients, so make sure that parents are clear on this and don't mix that up. Remember, if they have eczema on their face, that they should not be using over-the-counter steroids for this. They need a prescribed steroid that is of lower concentration for the face. Immunomodulators are being used a lot more these days because they don't have some of the side effects that we see with steroids. And basically, they just reduce or minimize the immune response to irritants by inhibiting T cell activation. So basically, they're just helping the immune system chill out a little bit and not overreact to what might be irritating it. And all of these things together are what help us provide comfort and then prevent infection, which I said is sort of our primary goal with eczema. Your priority nursing concepts for a peds patient with eczema are going to be tissue and skin integrity, comfort, again, so helping with that quality of life, and coping, making sure that they're getting sleep and able to do all those different things that they need to do. All right, that's it for this lesson on eczema. Let's just quickly summarize what we've talked about. So first, remember, eczema is the same thing as dermatitis, and that just means inflammation and irritation of the skin that can be triggered or caused by a bunch of different irritants. Second, our ultimate goal is to maximize the kids' comfort. And we're going to do that by avoiding irritants and treating that itching. So we're keeping that skin from drying out and providing those medications like antihistamines, steroids, and immunomodulators. And our third key point to take away is that we want to make sure we're preventing secondary infection by maintaining skin integrity. And those secondary infections that you want to be on the lookout for are impetigo and eczema herpeticum. Okay, guys, I hope you found this lesson helpful. Remember, eczema is really, really common, so keep an eye out for it during your clinicals, and I'm sure you'll see it and you'll be able to apply everything we've just talked about. Don't forget to look at the resources that we have attached to this lesson. There's a care plan and also a cheat sheet on skin lesions and terminology we use to describe it if you're feeling a little rusty on that. Now, go out, you guys, and be your best self today, and as always, happy nursing.